In the mountains of Afghanistan's Kunar province, the homes have sunk into the backdrop. Collapsed roofs and rubble, the odd dot of colour indicating survivors waiting for help. But such is the treacherous terrain, helicopters have struggled to land. The Norgao district of this region was the worst hit. More than 1,400 have now lost their lives after Sunday's earthquake, which struck at midnight as people slept in homes made of mud, sticks and stones.
Many people are still injured and under the rubble. All the houses have been destroyed. Many people are still missing, and they might still be under the rubble.
Some help has made its way to these isolated villages. The injured taken to hospital in Jalalabad city. Around 600 patients were admitted in the past 24 hours. The rest of the wounded are treated out in the open. Aid workers say those affected feel safer out here, especially after another quake shook southeastern Afghanistan today.
You have these aftershocks that are coming every half an hour, every hour. Families are scared that another big earthquake is coming. They are sleeping outdoors. Any shelter that exists, they're afraid of sleeping under in case it might collapse. I went to one area where they had patched together rice bags, empty rice bags and flour bags to create a space where they can sleep on the dirt.
As those rescued arrive in Jalalabad, the UN warned of thousands of children being at risk, and this being a race against time. The government and rescue workers are struggling against not just the weather, landslides and aftershocks, but a lack of funding. Cuts to USAID under the Trump administration have not helped, nor has a lack of international support since the Taliban returned to power. The UK has pledged £1 million and India has delivered 1,000 tents. China, the EU and others have also offered support, but aid is yet to arrive.
Afghanistan is facing one of the worst humanitarian crises on the planet before this earthquake took place. In just the last 6 months, we have seen nearly 2 million Afghans being returned from Pakistan and from Iran, already putting pressure on an overly stretched humanitarian system. And when we've seen the types of suspensions and cuts to funding, as we have in the last year, it means that that system cannot absorb any more shocks.
A system and country that cannot take any more, and yet knows there is more to come. That the death toll will rise, and with it, yet more broken families, as this troubled nation has to rebuild yet again.
Well, a little earlier, I spoke to Dr. Fareed Homayoun, the Halo Trust's Afghanistan Programme Manager, who is in Kabul. I asked him what his team have seen on the ground.
The situation is very desperate at the moment. The number of casualties is rising every hour. The latest figure we have is over 1,400 have been killed, over 3,500 were injured, and access to some remote villages is still through by helicopters. And so it's the situation is very evolving, and still the rescue teams are busy evacuating casualties from the rubble.
Help us to understand quite how difficult it is to reach that area, because it's a mountainous area, isn't it? And a lot of the roads just look like they're covered in rubble.
Yes, of course, they didn't have any tarmac roads to start with. So because of the rock slides, it's really a challenging situation. So helicopters, actually some soldiers are landing in places where there is no road access and taking casualties by helicopters from those areas. The most important thing is reaching to those remote districts and then evacuating them in a very difficult and challenging terrain.
And of course, so much international aid has been withdrawn from Afghanistan since the Taliban came back to power. Are there even the hospitals there to take this number of people? Presumably not.
I mean, basically, the majority of the casualties were evacuated to Nangarhar Provincial Hospital, which is run by the Ministry of Public Health. And what is happening there, all the private hospitals in Jalalabad, which is the capital city, they are providing free medical service and actually beds for the injured people. And so far, there's been no kind of lack of medical equipment or medical staff respond to this calamity.
And just tell me what you understand about concerns that women and girls will not be given the same priority as the male victims of this earthquake because of the Taliban's restrictions.
We have not seen such kind of discrimination at all. Basically, everybody injured is treated the same way, and it's a joint effort.
Okay, but it does happen, doesn't it? Under normal times, women are deprioritized in Afghanistan in terms of access to healthcare.
In the normal situation, probably yes, but in this situation, we have seen that everybody is treated the same, and people have been evacuated, and I think that medical staff, both male and female, are providing free medical service to, as far as we know, to all victims of both gender.
Okay, we hope so. Dr. Farid Homayoun, thank you so much for speaking with us.
Thank you.